Good evening, all. As the final exam of DM and DNB nephrology exams are nearing by, few of my friends have little bit doubt regarding the calculation of KT by V in peritoneal dialysis and also in hemodialysis. How to calculate? It's a simple, straightforward calculation. Especially for DNB final exam, it might come as a spotter, or sometimes in Viva there might be a question if you are having a case of peritoneal dialysis patient, or in even hemodialysis, how to calculate the residual renal function. So this KT by V or the clearance in especially in peritoneal dialysis, it's a simple straightforward calculation. As we know, KT by V is nothing but the clearance, which is just a mathematical calculation. As we know, clearance equal to UV by P. Urinary concentration, P is plasma concentration, V is volume. So basically we are going to have the 24-hour drain volume dialysate urea divided by the P plasma urea. So this gives the KT, which is the clearance for 1 day, and we have to divide it by the volume of patient like distribution. It can be calculated by any formula. Whatever the KT by V we are obtaining by this formulas for single day. So we have to multiply it to get the KT by V for 1 week, because most of the times we set the KT by V target for an entire week. So that is why we have to calculate it for a week. So whenever they ask for a examiner might be particular with these kind of points, residual renal function if a patient is having, that have to be added to the weekly KT by V. So directly going to the example, even though this details looks little bit uh, longer or lengthier, you can go through this. This is how the questions might be. At a glance, it might look little bit difficult how you are going to handle this question. But once you dissect the details, it will be very easy to calculate the KT/V. So what are the details they are giving? 50-year-old male, weight they have given, but focus on what are the details we want. The patient is on 4 exchanges, 2.5 liter he is doing. So total is 10 liter. Whatever the output is coming, in total we have to add it. So there is a net ultrafiltrate of 1.5 liter. Some question or examiner might give that directly the output volume. Sometimes they will give indirectly like this. 4 exchanges of 2.5 is 10 liter. Net ultrafiltrate is 1.5 liter. So total outcome, the volume drain 24 hours is 11.5 liter. So just leave the formula. The volume of distribution is 36 liter of urea, and the serum value and the dialysate value of urea. Creatinine we doesn't need. So how to calculate? We will go stepwise. The important detail is 50-year-old male on 4 exchanges 2.5 liter. Volume of distribution V is given. Serum and dialysate urea is given. So we'll go to the calculation. So this is the 1.5 liters and net you have to add it with 10 liter, because this you should not miss, because 2.5 liter exchanges he is doing. So along with that there's a 1.5 liter extra the patient have drained. So urea in the serum in the dialysate it is given. So we'll go stepwise. How to calculate KT by V? So 24-hour drain volume divided by the dialysate urea divided by the serum urea. Either it can be urea nitrogen or urea. Just I'm mentioning for the calculation as simply as serum and the dialysate levels of urea. Next, as I told you, 11.5, because 10 plus 1.5, 63 divided by 70. If you put this in calculation, we are getting 10.35 liter per day, which is the KT. So we have to divide this by V, which is 36. Since it is given in the detail itself, 36 is the volume V. So KT by V. So 1 day KT by V, if we have to divide it 10.35 by 36 is 0.28. So weekly KT by V, we have to divide it by 7. So the weekly KT by V is 2.02. So this is the answer for this question. Here we didn't focus on the renal KT by V. I hope you are clear. To make it a little bit more detailed view of this concept, one more question I'm going to discuss. Again, a big question, looks scary at first glance, but if you dissect the details, it will be very easy. So what they want to do, this time they have mentioned a 48-year-old female. She is on APD, 2.4 cycle nightly, plus 6 hours, 2 liter dual. So just what detail we are having, V is 32 liter. So here directly they have given 24-hour dialysis drain is 15 liter. So ultrafiltrate and all, like you can leave it, like, and they directly give 24-hour dialysis drain volume indicating 1 liter ultrafiltrate. So we have to find the urea level in the blood and urea level in the dialysate. So this is what the details. And one more detail they have given is the patient is having urinary, that is residual renal function is there. Urinary urea clearance they have directly given. With creatinine, using the GFR also you can calculate, but most of the time they will give the residual renal clearance. Urea clearance they have mentioned. So you have to use the urea clearance, not the creatinine clearance. You don't get confused. Suppose if urea clearance is not given, how you can find out? You can use the creatinine clearance based on the GFR. But most of the question, they usually mention this residual renal function as this much value. So now we will go to calculating the total KT by V. So first we have to calculate peritoneal dialysis KT by V separately, renal KT by V separately, residual renal function KT by V separately. For peritoneal, what is the formula? UV by P. So 24-hour drain volume, which is 15 liter, V by U, urine dialysate urea concentrate by serum concentrate. This is for a particular day. So 15 into 48 by 65, you put it in a calculator, you will get 11.1 liter per day. So we got the KT. Now we have to divide it with the volume of distribution. V for one day is 32. So 0.35 per day. KT by V of peritoneal dialysis per day we got. But what we need is per week. So 0.35 into 7 is 2.45 per week. So this is similar to the previous question. We have calculated only the KT by V of peritoneal dialysis for this patient, whether the target is correct or not. Now we are going to calculate for the renal residual renal function KT by V. How to calculate? Whatever they have mentioned is 2 ml per minute. So we need it for a week. So minute have to be converted into hour have to convert into day. So 2 into 1 minute into 60 hours. There are 24 hours in a day. We need for 7. So total, if you multiply all this, we are getting around 20 liter per week. It is only KT. We have to divide it by V, KT by V. The formula remains the same. You should not miss V. Suppose if it is a spotter, if your time is limited, many a times you might miss this V. So 20 by 32 is 0.63. So in total, we are having 2 KT by V. One is residual renal function 0.63, one is peritoneal KT by V. Just you have to add it. So the total KT by V of this patient is 3.08, and you can check whether it is in the target or not. So it is all about calculating KT by V in a patient with the peritoneal dialysis. Whether the residual renal function is given or not, you have to check. And this is the concept. With this, I hope you can clear the spotter, or if it is Viva, the concept you can answer. That's all. And all the best for your final exam.